In this video, we'll talk about cluster headache, which is a migrainous type of headache, most commonly seen in 30 to 40 years of age group and in males, and associated with smoking and alcohol. Right here, you can see this abnormal hypothalamic activity, which is noted in the functional imaging done during this attack. So, whenever they're having this cluster headache, if you do this functional imaging, you can see some abnormal hypothalamic activity. Right, so what will be the clinical features? First of all, there is a cluster headache, so there will be headache, right? So headache will be periorbital or retroorbital, excruciating worst type of headache, stabbing, boring pain, severe pain such that they may also commit suicide because of this pain, and the patient will be restless. Associated symptoms will be parasympathetic symptoms like unilateral lacrimation, nasal congestion, conjunctival redness, ptosis, meiosis, conjunctival infection. So all this will be associated with this headache. And in the cluster headaches, you can also see the circadian periodicity. What do you mean by it? So suppose this is the year from January to December, and one person is having this cluster headache in the time of February to March. So in the next year also he will be having this headache only between the February to March in this whole year. So that is the circadian periodicity. So here I said he is having headache between February to March. So it lasts for few weeks, February to March, and the remission for few months. So all this months after the March to December, he will be having no headache. That means he is having remission. But only between this February to March every year he will be having this. So it lasts for few weeks, remission for the following months, and reoccur at the same time in the next year. Again it lasts for few weeks and remission for the following month, and again it reoccurs during the same time in the next year. So that is what is called as circadian periodicity. Periodic with the recurrent bouts, and it begins in the same hour for weeks at the same time, right? So every year it is occurring in the same time. So these are all the clusters of headache. So it may be many attacks less than 24 hours also. Coming to diagnostic criteria, first there should be severe, very severe orbital headache, which can be lasting up to 15 minutes to 180 minutes, and it can last from 1 episode a day to 8 episodes per day. So they can be associated with parasympathetic clinical features like meiosis, ptosis, nasal congestion, lacrimation, sweating, conjunctival redness, irritation, itching and all. Right, coming to the management. So for this acute cluster headache, you will give them sumatriptan and also inhalation of oxygen and octreotide. Subcutaneous triptans, which is sumatriptan, it can be given in the subcutaneous injection. So that is for the acute cluster headache, and also inhalation of 100% oxygen, so 10 liter per minute for 20 minutes, and then octreotide. In this cluster headaches, you can give them verapamil, sodium valproate, lithium, and the neuromodulation therapy. So this is about the cluster headaches. You can remember it by the mnemonic SOCH. So S is for sumatriptans, which can be given as a subcutaneous injections. O is for octreotide and also 100% oxygen inhalation, right? And C stands for circadian rhythm, which is specifically seen in this cluster headaches. And by H, you can remember this abnormal hypothalamic activity, which is noted during active attack when you do this functional imaging. So this is the mnemonic. And also associated symptoms, parasympathetic symptoms, you have to write it: lacrimation, congestion, redness, meiosis, ptosis, and the infection. So if we summarize this whole thing, this cluster headaches is a migrainous type of headache seen in the 30-year-old male with the smoking and the alcohol history. There will be abnormal hypothalamic activity. So by the mnemonic SOCH, we have remembered S stands for sumatriptan, which is given in the subcutaneous injection. O stands for oxygen and octreotide. C stands for circadian periodicity, and H stands for abnormal hypothalamic activity, which is noted during the functional imaging during an attack, right? So coming to the clinical features, there will be worst type of headache, stabbing and the boring pain, excruciating headache in the periorbital and the retroorbital region, where it motivates the person to even commit a suicide, right? So the person will be restless. So this is about the headache. And coming to the parasympathetic, there will be lacrimation, congestion, redness, meiosis, ptosis, and the conjunctival infection. Coming to the circadian periodicity, it will occur in the same time in the following years also, right? So if it is Jan to December, the person is having from February to March. In the next year also, he will be having from February to March. So there will be recurrent attacks followed by the remission. In this line, there will be periodic attacks with the recurrent bouts, and it begins at the same hour, same week, at the same. So just write about the circadian rhythm periodicity. Diagnostic criteria, there should be very severe type of headache, orbital, lasting for 180 minutes, 15 to 180 minutes, and it can last for many episodes a day. For example, from 1 episode a day to 8 episodes per day, right? Many times in the 24 hours. And associated with parasympathetic symptoms like meiosis, ptosis, nasal congestion, lacrimation, sweating, and all. Coming to the management, acute management, SO, which is subcutaneous triptan, sumatriptan 6 mg, inhalation of oxygen, octreotide. And in the preventive, you can give them verapamil, sodium valproate, lithium, neuromodulation therapy. So this is about cluster headaches. Bye.